Hi, welcome to today's Leaders in Mental Wellness and Diabetes, where you will hear insights from the top minds in the world of diabetes care, hosted by Dr. Char.
Hello, how are you today?
Hi, I'm doing great. How are you?
I'm good. Am I pronouncing it correctly, first of all, Laura, and may I call you by your first name?
Certainly can. And the last name is Estan.
Estan. I knew that had something fancy about it, and that's Estan. I love it. Laura is a mindful diabetes telemed health coach, and she's from Connecticut, and I bet you can't tell I'm from across the country. I'm from Nashville. I'm sitting here in Nashville today, and thanks to this new era, we get to have this casual conversation about what we do in the world of diabetes and in mental health. And I'm so honored to have you as a guest. But as a mindful health behavioral practitioner, that you can tell us all about your specialty. Would you tell me what got you first? I'm type 1 in diabetes, and I'm into mental health. So duh, right there's my catch. But for you, do you have a connection personally with diabetes? And if not, how in the world did you get in our community and wanting to help us?
Thank you so much. And I'm so honored to be here as well. So I come from a family of people with severe diabetes that was not well controlled and led to severe complications that shortened their lives. So that was my uncle and my aunt, who were my mom's older brother and sister, as well as my grandmother, my maternal grandmother. And then my mother herself had diabetes, but because she was fortunate enough to have a daughter who is a dietitian and a diabetes specialist, and another daughter who was a nurse and a trauma specialist, as her endocrinologist always said to us, your mother is just so well cared for and one of my best patients, even at 84 years old with numerous age-related complications after her having diabetes for about 35 years at that point. So it was a family-driven interest.
Can I interrupt you before I'll forget when I go back? I'm sorry. But when you say your aunt and your uncle, your maternal grandmother, and then you say your mother does well.
Yes.
I just have to stop there a minute. When we say and when we recognize that it's who we surround ourselves with and what information we have, I have a grandmother that just did not know any better to do. And to know that you have a sister and you have your own life that led you down the paths that consciously or subconsciously got you. I have to take a minute to just sit in that. That is amazing. Your mother is the greatest benefactor, maybe, but what a stronghold broken, or she would be right there with her relatives.
Exactly.
So I am so amazed at that. One's a nurse, one's a dietitian, and what have you done? What did you either of you go into it with the idea of we're going to help mom, or is that just a side effect? Oh my goodness, that's awesome.
It's just an automatic in our matriarchal family. But the way that we in our family ended up in healthcare was a family business as well. My mother was a registered nurse, and my aunt was a registered nurse and an administrator, and they ran a nursing home. And so when we turned 16, it was just assumed that you would become a nurse's aide in nursing school. Well, I was the black sheep, and I was afraid of needles, and I associated being a nurse with needles. And so when I was the oldest one. So when it came my turn and they just assumed I was going to become a nurse's aide, I said, that's okay. I'll go to the kitchen and I will wash the pots and pans and the dishes and take care of, help with the food and everything. And so that was what started me on my path.
Sweet.
And we had a dietitian there at the nursing home who always took the time to explain to us teenagers why we had to make different foods for the people with diabetes. And this was something that is very much present in my practice today, because I am not a proponent of people with diabetes eating anything special or differently than a person who doesn't have diabetes. And so that's a big part of how I help my clients understand that what's good for them is good for their family as well, because anyone who has a family member who has diabetes, type 1 or type 2, but more so type 2, there is a very strong environmental and familial association with that risk of developing type 2 diabetes being significantly greater. There's different types of reasons and research that also has an association for type 1, but it's very, very different. And that's kind of a different conversation on another day, but it goes to the fact that type 1 being an autoimmune disease and type 2 being a chronic disease lifestyle.
Sure.
Yeah. So, today, one of the biggest things that I help people understand is that this overwhelming recommendations that their doctors making to them when they're diagnosed with prediabetes or diabetes is not the reality. It's just unfortunately a problem or an issue with our healthcare system today for people with blood sugar issues, and the doctor doesn't have the resources or the time to explain to them. And he himself may not really even know that well himself. And so to have access to a diabetes specialist who's a dietitian or a nurse can really make a difference in the newly diagnosed person's life, as well as the person who just never had the benefit even 10, 20 years ago when they were diagnosed, because it's not like you can't eat the foods that you love. It's more about how much you eat, when you eat, and how often you eat during the course of the day. So I get a lot of pleasure, and I go back to that little teenager who was working in the kitchen in the nursing home, who was so sad when she had to tell the little diabetic lady in the wheelchair that she couldn't have cake for dessert because she was a diabetic and she had to have diet Jell-O with artificial whipped cream on it. It broke my heart. And so here I am, almost 50 years later, helping people to understand that they can actually have a piece of cake. And I teach them how they can do that.
That is amazing. That is so good. And that heart that shows forth all the way back then makes me want to tear up, because I know what it's like to want the cake and try real hard. Most of the time choose the Jell-O, but the guilt that comes along when you chose the cake anyway, and didn't have a dietitian bone in your body and didn't know how to do it the correct way. And just because we've been diagnosed doesn't mean that we know how to be an expert for our own bodies and our own lives. But how do you connect that? I see that you're in mindful health, and of course that touches every nerve in my little world. How do you connect the food we eat, the needs we have nutritionally? How do you make that all fit up with the mind, body, and spirit world that makes us holistic and with wellness as our mindset?
Yeah. And so that was part of my own personal journey. After a significant life trauma of my own, I found myself in my 40s and thinking about going into my 50s, and my risk of diabetes, as well as my own weight issues, and stress in my life. And I gave up teaching public school and decided to go back into work as a dietitian. And I opened my own complementary and alternative medicine center. It was called Becca. And that was back long before we did any of those things. If I had opened it 10 years later and in a different town or city, I would probably still have that wellness center and that retail operation. But that was what propelled me, my own journey, and then my desire to share holistic health And what we used to call complementary and alternative medicine, we now call integrative medicine. I did a study at the Kripalu Yoga Center on holistic health education. That's where I learned how to meditate. I learned how to do yoga. I learned how to do intuitive and mindful eating, all for myself so that I could heal myself after my life trauma and then share that process with my clients and the people in my life, my family and friends as well. And even the people in the grocery store or in the park when I'm walking. In fact, at the library with my grandson the other day, somebody overheard me say I was a diabetes educator, and she came up to me and asked for my information for her mother, who was struggling and has never had the benefit of speaking with an educator, a diabetes educator, to help her figure out what would work for her. And so that's the biggest thing with holistic health that I realized all those years ago was there is no one-stop shop, I guess we say, right? One-stop shop when it comes to our health. And for diabetes in particular, that's especially important because what we now know about our body and how our body uses the food that we eat as fuel, as well as how our body responds to physical activity, and then most importantly, how stress affects all of that, it's different for everyone. And so there is no one way that's going to work for everyone. And that's the biggest challenge with diabetes. And so being a person who's practicing mindful diabetes self-management is a person who's paying attention to what works for them and how they feel in the moment in relation to what they ate, the activity that they did, the stress that life's throwing at them, and what their blood sugar numbers looking like.
Yes.
Right. And that's one of the biggest factors that I find. We're finally making some progress in the realm of insurance reimbursement and the cost of being a person living life with diabetes. The CGMs, or continuous glucose monitors, are a life-changing device.
Yes.
Right? Right, as you know, but now we're finally getting them into the hands of people with type 2 as well. When I meet a person with type 1 who does not have a CGM, it breaks my heart. Mm-hmm. Never mind an insulin pump. I mean, I can understand somebody not wanting an insulin pump on type 1 if they're used to doing their injections themselves. But we're finally moving to a place where people who have needle phobia or who have dexterity or vision issues, which so many of our older people with diabetes have for different reasons, they have a hard time doing finger sticks, and it hurts. Mm-hmm. And it takes a toll on your little fingertips. And so many people with diabetes are already dealing with some chronic pain related to the complication that affects the nervous system, that if I had a magic wand and I could do one thing and one thing only with my magic wand, and then it would be taken away from me, it would be to put a CGM into the hands of every single person who's been diagnosed, not just with diabetes, but also with pre-diabetes, as well as into the hands of every single person who doesn't even have a blood sugar issue, but has a weight issue.
Oh, yes.
So that's how adamantly I believe in blood sugar monitoring. And the blood sugar monitoring really is the most mindful piece of practicing mindful diabetes self-management. Good job.
I'm just showing my Dexcom 6 just told me my blood sugar an hour after lunch was 174. Not the greatest, but not the worst.
Well, for 1 hour after lunch, a lot of people tell me that sometimes when they finally get a CGM, they look at it too much. Right now with type 1, I don't believe you could ever look at your CGM too much, because especially if you're difficult to control, that's a different story. For type 2, I encourage people to just look at it at certain times of the day. If it's a new toy, it's an awesome device, look at it every 15 minutes if you want when you first get it. But sometimes too much information can be too much. For instance, or my best example is when someone realizes that their blood sugar actually goes up after exercising. This is something that type 1 children know and are taught, but we don't normally educate type 2s about this. And they freak out and they're like, I don't understand. You told me exercise was good and it helped lower my blood sugar. And I checked it after I exercised and it was high. I'm like, yeah, so that's why I didn't tell you to check it after you exercise. I want you to check it like 4 to 6 hours later. It's going to be much lower. And then they realize. So that's a good example of when we can be a little overreactive to our numbers.
Let me share with you when I got the Dexcom. You have to remember, I've been doing diabetes almost 50 years. So I peed on a stick. Yes. I remember, forget sticking my finger with a needle. I had to learn to not like that later, but I peed on a stick. Anyway, there's just that whole story. I've had a pump. I don't have a pump. I've done every kind of, 50 years, let's face it. So when I got the monitor on my phone, we were so mesmerized that it would tell me, because I've always been old school. They called it brittle. And so to have something check me during the night and beep, 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 if my blood sugar bottoms out, it's life-saving. Yeah. So there was this device now that I could share, and my husband would know my blood sugar miles and miles away if I'm home alone and my blood sugar drops and I don't know my name. Yep. Until I was with a patient and I kept getting this beep from him, and I didn't take his call. And I knew what my blood sugar was. I know it's telling me it's going low, but I also know I have a patient and I know I'm taking care of business. I know what I'm doing. I pop one of those little glucose things in my mouth. I know what I'm doing. I'm not answering him. He's teaching a college class, excuses himself, goes to the corner of the room and calls me again. And I excused myself and I turned my head and I said, yes. And I said, yes, I'm with a patient. He said, check your blood sugar. I hung up. He was worried that something was going on with me and disrupted his whole life, disrupted my whole life. When I got home, I said, you don't get a share. You don't get a share. I can't do this. So it can be such good information that it can create you a funny story for the rest of your life. And some of my videos now, I say, if one more of my loved ones ask me, what is your blood sugar? Because this dang phone beeps. It beeps if it's up, it beeps if it's low. And so you have to learn to manage it, but it is absolutely one of the best inventions in the world. So I'm very grateful for that. Now, when you connect that knowing with anxiety or stress, a family feud because they've aggravated you to pieces. I'm just teasing. I wouldn't have told you that story if it was really harmful.
You can't eat that because you have diabetes. And I tell my patients all the time, you need to politely inform them that you're aware that you have diabetes, that you live every day with that, and that you appreciate their concern. But the last thing that you need is somebody else telling you what you can and can't eat, and that you are perfectly capable of managing your blood sugar in relation to the food that you eat and the activity that you do every day, and that we don't restrict foods the way we used to. We don't teach children with type 1 that they can't eat anything. And we teach them a completely different way. And so that is what we call diabetes distress. So one of the things that the American Diabetes Educators Association, it's got big long letters, ADCES, the American Diabetes Care and Education Specialists Association or something like that. We have these self-care concepts that there's 7 of them, and they're all the different aspects of what we call diabetes self-management. Well, thank goodness, a couple of years ago, they added coping to that list. It became the 7th, and it was down there at the bottom. And because we have come to realize that diabetes distress, in addition to true psychological and I shouldn't say true, but intense psychological and or physical stress, which is different than diabetes distress, but similar, that these things, this aspect of living life with diabetes affects every single other of those core aspects of diabetes self-management that we teach and support our patients living with diabetes on. And doctors, because they're such logistical critical thinkers, saw it at the bottom of the list and thought it was least important.
Mhm.
As many logistical thinkers would do, right? They think that it's numbered from 1 to 7, and it's not. So this past year, the association actually moved coping skills from the bottom to the top of the
Woohoo!
in recognition of some awesome research that's been done around the concept of diabetes distress. There is actually a diabetes distress scale and a list of 24 questions related to all aspects of diabetes and living life with diabetes. And so, there's a certain rating score, as many of these questionnaires are. You're familiar with a lot of these as a therapist, and it helps us not so much to see or identify the degree of diabetes distress in an individual, because all I need is about a half hour to 45-minute conversation with an individual with diabetes, and I can tell myself their level of diabetes distress pretty well, pretty quickly. But it helps them to understand and recognize it, because as you know, as a therapist, to this day, especially for our generation and pretty much the generation after us, and very much so for the generation ahead of us, those who are already retired in their 70s and 80s, the idea of acknowledging that we have some psychological challenges, okay, has a negative connotation or association. Particularly from the World War II generation, it implies that you are less than, or that there's something wrong with you. And we've done amazing work helping young people to understand and accept and to take steps regarding developing a support system and seeking help when their emotional and psychological wellness is not what they would like it to be, or they're not comfortable with it. And thank goodness for that. So diabetes distress, the diabetes distress scale often helps people simply automatically themselves by answering those questions. Then I can say to them, so do you see how these aspects of diabetes and living your life day to day with diabetes, that these things are affecting your degree of holistic wellness, your sense of well-being on a day-to-day basis? And they don't need me then to tell them. They're able to see it themselves through answering those questions. The biggest step then is to help them understand that seeking supportive help through some type of psychotherapy is the absolute best thing they could do for themselves. And it doesn't matter how well a person may feel they are, you can always be more well. and so in that sense, especially because of my own experience with life trauma, my husband committed suicide at a very young age.
I'm so sorry.
Thank you for that. I appreciate that support, but I was a very fortunate person because I had a family that had let go of that stigma around seeking mental health therapy and support. And so I not only had a very supportive and loving family, but I had awesome therapists who helped not only myself, but my children to get through a very difficult time. And so it is very important for me to then help the people that I'm working with diabetes and different levels of blood sugar issue, pre-diabetes or weight management issues, as well as diabetes 1 or 2, to help them to recognize the connection between their mind and their body. So that's at the heart of that mindful diabetes self-management. We have historically treated diabetes as a numbers disease. You know, we look at the A1C number, we look at the blood sugar number, we look at the lab numbers, we look at the weight number. We look at the calorie number that we're taking in, all these numbers that are only one little piece of it, and really helping anyone to understand what those numbers truly means connecting those numbers to how they're feeling and what they're doing on a day-to-day basis. And to free them by helping them understand that it's not an impossible task. So many people that I talk to when I'm working for insurance companies, many times people get my services for free as a benefit of their insurance company. And so I'm always surprised how many people don't check their blood sugar at all for whatever reason. Many because they think they don't need to or don't have to, or their doctor never told them to. And so I educate them on that. And I make sure that needle phobia isn't really the issue, which oftentimes it is that underlying concern. But I help them to understand that our blood sugar affects our mood more so than anything else in the moment and on a day-to-day basis. And so many people with diabetes struggle with the fact that it's a disease we don't feel, right? We don't feel it in the moment. We can't feel our blood sugar, so to speak, when it's changing. However, with mindfulness, we can learn to feel the changes in our body related to our blood sugars. And using a glucometer or a continuous glucose meter helps us to focus in on that, to learn that. Many times people are able to walk away from frequent blood sugar monitoring because then they say to me, oh, I now know how I feel when my number's going up or my number's going, and so I don't need to check it as often, that type of thing. And that's a wonderful thing to hear. But through that increased monitoring, they're able to make note of not only how they feel when their blood sugar is higher or lower, as well as how they feel when it's where it needs to be or should be for safety for them, as well as the effects that their physical activity and the food or fuel that they put into their body have on their blood sugars. And through that increased awareness, because that's another more mainstream word, I guess, for a lot of people. I had a friend who's got diabetes, who's about 10 years older than me. He's type 2. And he says, are you sure you want to call it mindful diabetes self-management? Not everybody knows what that means. I'm like, well, my mission is to help everybody to know what that means. Because you can call it mindful, you can call it paying attention, okay? That's really all it is paying attention, not just to the numbers, but also to how you feel in the moment. And through that awareness, you can free yourself from diabetes controlling you, and you can control your diabetes.
Oh, that is so good. It is taking us, putting us in the driver's seat, our deciding we are the leader, we're the boss of us, and we make the choices and we live with the consequences. Now, when you said about distress, and I'm not going to hold you much longer, but when you talked about distress in diabetes as different, and it certainly is, there's a lot of difference, but sometimes my history tells me we saw it as less evasive as somebody that had been diagnosed with a mental health disorder. Now, I could talk all day on why that is, but the truth is the distress that diabetes people feel it's just so riveting. For instance, if my blood sugar is 45, my mood changes. Not only do I live in a world now that allows distress, that allows emotions to be recognized and help to be gotten, but it also puts the responsibility with good training on me. Yes, my mood can change on a dime, and that is a direct result of a blood sugar number going cuckoo. Yeah. But as soon as that is corrected, it's my privilege, my responsibility, and my obligation to write that in me. So to teach patients, first of all, it's okay to feel those things. I had doctors, they used to tell me I would love to refer patients to you, except I don't want them to think I believe they're crazy. I had doctors say that to me.
Yeah.
And after I let them out of their closet that I locked them in. No, I'm just kidding.
Yeah.
But I now live in a world where that's not the case. And the specialists and the professionals of the world like you refer people daily to get that help. Not only now can they acknowledge that emotions are such a huge part of it, but now we can understand what part is ours too. They're not the boss of us. They're not the leader. They're great followers, but they're not great leaders. And so we now can know it's my responsibility that when my husband, who is seeing patients in another facility on another computer right now in another country, and when he comes home and it's our dinner time, I might have had a great time with you and get in the car, my blood sugar drop before I get to where we plan for my piece of chicken and salad, and my blood sugar drop and he make a wrong move on the road and me go, rah, 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 rah. That's happened more than he would like to have happened. But when 15 minutes later, after I've corrected that, and my blood sugar now is 84, waiting for my salad and my piece of chicken, it's my obligation, but it's also my privilege and my responsibility to change that mood. And one of the ways we can change our mood, I'm going to share this with you, and then we're going to close in just a few minutes. One of the studies in the 50s where they said, raise your hands high, smile, now try to feel like poop. You can't? No, because that's a posture that brings joy. If nothing else, if you pass me on the street and my hands are up in the air or out the window, I might have had a low blood sugar. I might have been snappy, but you better well believe I know how to turn that mood around and take that off my shoulders and off my husband or my son's plate. Don't you love that? Now we can have the full circle of knowing how to let somebody know that has diabetes that we care compassionately about them, and we don't see them with any less issues, if not more. The mood, the changes in behaviors are sometimes more and heavier on patients with diabetes. But there's a flip side to that. And now we can go full circle, and we can not only be trained as patients, but we have the privilege to share it and go full circle with the world. And I am so grateful to have just getting to meet you and know you're holistic in your methods, and you are mindful, and not just the nutrition, not just the numbers, but by grannies, we can't deny their importance.
Yes.
And so if you had one thing to do today, well, you're going to have to give us where we can get in touch with you. But if you had one thing to give us today, and you only had one opportunity to talk to one gal or guy, and you were to give them one piece of I hate the word advice, but one piece of instruction that would help them move forward today, what would it be?
It would be for them not to walk their diabetes life, their diabetes journey alone, to seek out and develop and cultivate their support system, their team.
Right.
That is the single most important thing. And your doctor is part of that team.
Yes.
Not in charge of the boss or the boss of that team. You are the boss of that team. And so I would wish that everyone who's living life with diabetes would first and foremost recognize that they are in charge. They're the head of their diabetes support team. And then they need to cultivate that team, and they need to cultivate effective communication and be in a positive relationship with that team, which isn't always a positive process. There's always struggle when we're in close relationship with others, but it's a beneficial process.
Yes.
And that alone will improve your diabetes self-management on a day-to-day basis. just as much as if my magic wand made sure you had a continuous glucose monitor in your hand, which would be my second wish for everyone.
So, so good. Where can we reach you? Because if everybody were to look for a team today, they would benefit by having someone that specializes in nutrition.
Yep.
But if that someone that specializes in nutrition understands the thought process and the emotions enough to help them while they're making all those food choices. What is it? We got 119 choices for food a day. Are you kidding me? And there's been many days I've wanted all 119. And then the guilt that comes along with that. It's crazy.
Or the frustration of being hungry for something that you don't know what you're hungry for.
Sure. So if they want you, how do they find you?
Couple of ways. First and foremost, www.lauraestan.com. My name, LauraEstan, all one word, .com. That's my website. And if you scroll down on the front page, there's a contact form. Fill that out. That puts you on my mailing list for just general updates and offerings that I have, as well as special events if you happen to be in the New England area and or Florida in the coming years. And then I am on Facebook as well. And on Facebook, I have a support group, but the easiest way for me to connect you with the Facebook support group is for you to go to the website and just let me know that you're a Facebook user and you'd like to be a part of that Facebook group. And I offer anyone and everyone a free consultation, which is really a free session. It's not really even a consultation. It's a good hour-long conversation with me to discuss where you're at and how I can help you, and whether or not working with me on a regular basis is something that would be beneficial for you, and how I can make that work for you. I'm very adaptive to that as well. So I encourage anyone and everyone who would appreciate some support for figuring out how to be more mindful of the fuel, the way they fuel their body, and how that affects their feelings on a day-to-day basis and their diabetes self-control. Please don't hesitate to reach out. It's easiest through the website, but if somebody is not comfortable with a website, they can also send me an email. That's a harder email. Actually, I shouldn't say it is. I'll give you the easy one. It's laura.estan, so laura.estan @outlook.com. And you can just write to me whatever you want. Please don't put too much real true medical information in your emails. They're not technically HIPAA secured, but you can share with me a little bit about yourself, the best way for me to reach you, and we can figure out a way that we can talk, even if it's just a regular phone conversation. I'm a good old-fashioned gal at times, and a lot of people aren't comfortable with all this fancy new technology. If somebody just wants to talk to me on the phone, I do that with my Aunt Robbie. She's given up the Zoom stuff, and she says, "Can you just call me?" And I'd be happy to just call you as well.
That is so gracious of you. It really is gracious of you to look behind you and meet those needs, and then take the challenge on of all the new stuff that we didn't learn early on that 12-year-olds know. And it is such a pleasure meeting you today. And I'm going to follow you myself.
Oh, awesome. I look forward to talking to you again and learning more about your awesome adventures and being there for your viewers. And maybe, who knows, maybe someday in the future we can do a collaborative diabetes talk board or something.
Let's do that. Let's do that. Okay. It's so nice to have you. So nice to meet you. And we will meet again.
Wonderful. Thank you so much. And thank you, all of Dr. Char's viewers. Bye-bye.
Bye-bye.